Over to you, please.
First of all, I would like to thank you, the kind production of the chairman. Today, I would like to present my topic, multiparametric ultrasound for assessing the chronic liver disease. This is the purpose of my talk. This is the outline of my talk, the introduction, technology branches, and some clinical application and discussion and conclusion. How about the chronic liver disease? The definition of chronic liver disease is a pathology process that lasts at least 6 months and cause decrease in the liver function to its stage. Many etiology of chronic liver disease. Most of them we have chronic hepatitis B in the ASEAN countries, and after that we have metabolic disorder like MASLD and MASLH, and after that we have alcohol liver disease. So as you know, the chronic liver disease have a destination is the cirrhosis of the on kind of the etiology. And the burden of the chronic liver disease in the global, you can explain how we have to focus in the chronic liver disease. Every year we have 2 million deaths per year, and responsible for 4% of the death of the globe. This slide you can see how progression to fibrosis, liver fibrosis in the many kinds of etiology of the liver disease. The liver disease, when progress in the cirrhosis, we have complication of this liver disease, including portal hypertension, of the failure of the liver, and very important complication is the formation of HCC, hepatocellular carcinoma. In the past few years, we have a conventional ultrasound to investigate the liver, including the B mode ultrasound and Doppler ultrasound. In the B mode ultrasound, we chose investigate the parenchymal structure and the size, the shape, and attenuation by qualitative only. And with the Doppler, we can only have little information about the hemodynamic of the liver. Nowadays, we have the change of in radiology. We have called the quantitative ultrasound, QS. This is a technique that can extend the physical description, the parameters. Therefore, we can evaluate the biophysical information of the tissue, help to investigate the quantitative of the pathology process. So we can have a new concept of US-based biomarker, some chemistries. We have a liver stiffness, a decrease of serotonin, a decrease of inflammation. And now we move to the technique of the multiparametric ultrasound. As the definition of the Professor Paul Siêu, multiparametric ultrasound is advanced and non-invasive diagnostic approach that combines several imaging techniques to provide comprehensive assessment of the liver health in one examination only. So we can see in the picture multiparametric with we have B modes, Doppler modes, siêu dispersion, attenuation coefficient, Mercator effect, US ultrasound speed, and microvascular ultrasound, CUS. And nowadays we have AI technology can assist in the multiparametric ultrasound. I talk about the branches of the electrography. In this slide you can see the branches with the RP branches. We have a technique to follow up the shear weight formation in the liver, so we can have elasticity of the liver. And now this slide can show you how to quantification of the fat in the liver. We can base on attenuation coefficient. We can base on mass scattering coefficient, and we can base the speed of ultrasound to measure the fat in the liver. And another parameter in the ultrasound or multi-parameter ultrasound, we have viscosity or dispersion. And that is the change of the velocity of the attenuation of the seaweed due to the viscosity in the tissue. And now we move to the branching of microvascular. In the microvascular ultrasound, we use the specific filter to get the blood signal from the slow flow and the microvascular as well. The video can show you the microvascular in the liver compared to the compression power Doppler. We can see the more detail of the vessel, small vessel near the surface of the liver with the high resolution with fast acquisition and decrease the motion of the fat. Additionally, we can quantification. We can have a quantification information of vessel density. Another technique of multi-parametric ultrasound, we have a series based on oscillation of the bundle, micro bundle in the ultrasound field. We have this technique, the series. With series, we can inject the ultrasound contrast agent into the vein, and we can get the hemodynamic vascularization of the lesion in the liver. And we can use dynamic contrast enhancement ultrasound to have a quantitative measurement of the enhancement of the liver lesion. Now we move the application, some application of the multi-parametric ultrasound. First of all, I would like to talk about the non-invasive diagnosis of liver fibrosis, stable liver disease, and inflammation of the liver. Thanks to the electrography technology, we can have information of liver fibrosis. And many studies show yes, a correspondence between the electrography with the pathology when we study the F1, F2, F3, F4 of the fibrosis of the liver. And now we based on the attenuation image or best scattering coefficient. We can measure the fatty in the liver. In this picture, we can see the attenuation coefficient of this case with the 74 decibels per centimeter per megahertz. We can diagnose it and staging of the liver liver. And of course we can investigate. We can assess the inflammation decrease of the liver in case of hepatitis. Now we move to application of the stratify the severity level of the disease according to the rule of 4, according to the guideline of the radio group of Society of Radiologists in ultrasound. We based on electrography velocity of the liver. We can rule in or rule out the compensation advanced chronic liver disease, and it's very important for clinician, hepatologist to know the patient with the compensation advanced chronic liver disease and clinical significant portal hypertension as well. And in the guideline of the World Form, in this guideline, we guys that we have to take a seaway to measure the liver stiffness to follow up this patient in the case of chronic liver disease. And we move to another application that is help to prognosis and help to have indication of the treatment and monitoring as well. According to the AASLD recommendation on the treatment of the chronic liver disease, in case of the liver fibrosis superior to F2, we can have antiviral treatment for the patient regardless the level of the ALT, AST. Normally, AST, ALT more than 2 times of the upper limit normal, we have to treatment. But in case of elevation, but no 2 folds of upper limit normal, we have an indication to treatment for the patient. In case of mass metabolism associated steatohepatitis, in case of the patient have elevation of liver fibrosis F2, we should pay attention to treatment for the patient. In this case, the patient diagnosed with a mass which superior to F2, and the patient had a fit over 2.67. In this case, we use attenuation imaging. We have the diagnosis. The patient have a S2, and this patient have electricity is very high, 11.93 kilopascal, corresponding to F3. So this patient have pay attention to treatment by medicament after diet, have a patient diet and exercise the patient. And we can use multi-parameter ultrasound to follow up the response of the patient when we have treatment the patient. In this case, I follow up this patient from 2020. In this patient, he have hepatitis C, and he obtained the ciliary virus response. And after follow up 5 years until now, 2025, then the patient have F2 only. In the beginning of the treatment, he diagnosed F3, F4 with 1.98 mass per second, corresponding to F4. And another patient in 2023, we diagnosed the mass and with the attenuation coefficient with 83 decibel per centimeter per megahertz. After follow-up of 1 year after, the patient become better in the clinical side, and with attenuation coefficient with 0.76 per second. And now another application, multi-parameter ultrasound, that is the one-stop shop of shopping only. In this case, the patient with 58 years, and the patient have a diagnosis of cirrhosis due to hepatitis B, and the patient in the program of screening every 6 months. And in this case, we can see the ecostructure of the liver is very close, corresponding to cirrhosis. And we use AI assistant ultrasound. We can trust AI ultrasound can diagnose, can signal, can warning this patient have a fatty liver and have a small lesion in the segment 6 with the diameter 17 millimeter. And the patient will have a portal hypertension via the Doppler ultrasound of the portal vein. You can see the velocity of the portal vein is very low, and the spectral of the power of the portal vein is loss of the modulation. And the patient was diagnosed by multi-parameter. We have the elasticity of the liver is very high, correspond on the F4 with 16.75 kilopascal, and the patient have a little bit high fat. There is no fatty liver in the patient with attenuation coefficient in the normal limit. And the patient I use microvascular to investigate the load of the focal liver lesion in the segment 6. In the microvascular ultrasound, you can see many deformities. Count this small vessel inside your lesion. Compared to the conventional power Doppler, we cannot see anymore anything signal Doppler inside the lesion. So I continue to adjust for the patient to examination the CUS. This is the video show the CUS of the focal lesion of the patient. We can see the contrast enhancement very strong in the arterial phase, and continue to enhance. And after that, in the end of the portal vein, you can see the wash out of the lesion in the lesion, and in the delay phase, you can see the wash out, the continual wash out, and in the technique, you can see the arterial phase with the very sensitivity, especially specific to diagnosis the liver disease. And in this case, we do dynamic CUS. We can have intensity curve of the lesion compared to the patient, and control compared to the background of the lesion. And in this case, we can have many parameters of the CUS, DCUS to diagnose this patient. For summary, this patient have a focal lesion in the liver cirrhosis. In the video, you can see the purple phase. Couple of a little bit 10 minutes after injection, you can see the wash out of the couple of in the contrast in the couple phase. So this is very typical of the for diagnosis the heart disease is the patient. Now I would like to move to the discussion. So the multi-parametric ultrasound, we have many advantages. Thanks to the multi-parametric ultrasound, we can assess the liver in a single examination. We can call one-stop shopping. We can see the techniques are non-invasive and cost-effectiveness compared to MRI or CT technology. And we can carry out this multi-parametric ultrasound at the bedside of the patient, and we can repeat many times when we have intention to monitor the patient. Both multi-parametric ultrasound have a disadvantage. The technique is only installed in the high-end system. So I think in the future, manufacturing can increase this many function, many technology in the low end or medium end system. And of course, the technique still depend on the operator. So we need a short time to change. And of course, in the patient with the high MI, we can have we can confront a little bit difficulties. So I summarize this is my topic. multi-parametric ultrasound is considered and screening test to detect the patient at risk as the chronic liver disease at early stage of the disease and to prompt the treatment intervention so they do not progress to the in the advanced stage. And multi-parametric ultrasound is used to monitor chronic liver disease in patients to detect in the early stage and to detect and in case of metabolites associated with the stable liver disease, multiparametrics is useful to monitor the patient to detect detect mass in the early stage. And if the patient progress to the compensating advanced chronic liver disease, multi-parameter ultrasound can screening to detect early liver related liver events such as HCC, portal hypertension, high risk of varicose varicose in the advanced chronic liver disease. If we have write down the focal liver lesion, we can use a multi-parametric ultrasound and we can diagnose the liver focal liver disease via serious virus. And today we can use AI integrated ultrasound to enhance the performance of ultrasound results. In the system of VINNO, we can have many multi-parameter ultrasound to pursue to solve the problem of chronic liver disease and focal liver disease as well. Conclusion: chronic liver disease with many etiology. Some common include metabolites associated steatohepatitis liver disease, chronic hepatitis B and C, alcohol liver disease, and cirrhosis is the end destination of most of chronic liver disease. In the past, conventional ultrasound only provide information about morphology and to ask diagnosis. However, it does not provide quantitative information about the physiopathology of the liver. So multi-parametric ultrasound provides quantitative information about the several biophysical and biochemical characteristics of the tissue through ultrasound biomarker, including stiffness of the liver, status of the liver, degree of inflammation. So I would like to conclude that multi-parametric ultrasound contribute to the objective certification of pathological severity, prognosis, and health to treatment indication and health monitoring and treatment response as well. Thank you for your attention.